People with disabilities face a lot of barrier, particularly women with disabilities. First barrier is education. People at home, family and the society feels that why do we need to study when we will not be able to work. The government policy is also not supportive. There is nothing specific for women with disability. They do not have specific programs or the budgets, and also there is no justice mechanism. For example, if there is sexual harassment or domestic violence, the victim do not know where to go and what to do. During COVID-19, there were more problems and even more problems for people with severe disabilities, intellectual disabilities, autism and spinal cord injury, also multiple disabilities. The first problem was of communication, information about COVID-19, the services offered and precautions to be taken was not available in accessible formats, especially in braille and audible tapes for persons with visual impairment, video graphics, material with subtitles and sign language interpreter for persons with hearing impairment. People responsible for handling emergency response services were not trained on the rights of persons with disabilities. During quarantine, essential support services, personal assistance and physical and communication accessibility should be ensured. Even when the vaccine drive started, priority was not given to people with disability. Did we think where the vaccine center disabled friendly? How are people with disabilities goes for vaccine? There is a special ambulance needed, plus at least 2 people to take them there. The communication for COVID-19 related news was not disabled friendly. The Nepal Disabled Women Association (NDWA) represents more than 800 women and girls with disabilities in Nepal. Organizations like NDWA and other community organizations and local groups played a vital role in supporting women with disabilities during times of COVID-19 through various community level interventions. We have reached more than 1,500 women with disabilities, including vulnerable population like the elderly, aging group and single woman households. The organization gave out essential food supplies, dignity kits, assistive devices, health and hygiene package and also made capacity building efforts so them could earn with dignity. The community organization also became the voice of people with disability, participating in various consultations improved accessibility for people with disabilities. The whole idea is that even in times of crisis, there must be efforts to ensure continuation of support services for people with disabilities